want to introduce our speakers today. We have Becky Kelly, who's our Director of Payer Relations, which is code for she works with insurance companies and understands how they work most of the time. Yes. And Jan Hoy in the red sweater works with Becky. They also serve as patient advocates with the insurance companies as well, so they understand where things go wrong. An example being you don't enroll in a plan that has a Billings clinic physician in the network, which is really challenging, and so that's one of the things they're going to explain to you. JJ Carmody is here in the beige suit. JJ is our Director of Health Policy. She's also an expert in reimbursement through Medicaid, Medicare, and some of those government funders, and understands how that works. She also has been one of our people who's worked on Medicaid expansion, and that's also called the Montana Health Plan, or also the Children's Health Insurance Program, which goes through the state. So she understands most, if not all, of how that works. And we're going to start with Dr. Michael Temporal. This is where the rubber meets the road. Like, you want to see your doctor, you want to prevent sickness, and you want to be able to get in when you're sick. So Dr. Temporal is going to just start with what health insurance means to us and why it's important. Dr. Temporal works downtown here, right, as a family physician, so he sees patients of all ages every day and is very well aware of the benefits of health insurance. So thanks for coming today. Feel free to take notes. We have some handouts for you, and please feel free to share this information with other people who may need health insurance. Thanks. Oh, we will not be talking about Medicare. Medicare, there's no changes to Medicare related to the health insurance marketplace. If you have questions about Medicare, we do have Bob Kelly here. He's in the blue shirt over here, and Bob is in our senior life department, and he can meet with Medicare folks who need help with Part D or some of those specific things, but we are not talking about Medicare today. If you qualify for Medicare, you don't need a separate health insurance plan, so that's why it won't be covered. However, if you have children or nieces and nephews or people who you need health insurance information for, then that's great. We will have some folks here out front who can help make appointments as well, and Becky will share that later. So we'll have some follow-up for you if you need that. Okay, Dr. Temporal.
Okay, well, thank you very much, and thank you all for taking the time to be here, because I think that, learning about health insurance, learning about how to get our family and our friends involved, and helping them get covered is an important aspect of what today's presentation is all about. And, just as a show of hands, how many people have been to a doctor or had to seek health care in the past year? Okay, how many people had difficulty or challenges getting into some of that? Okay, some maybe not so much. Well, and, I think that the key to having health insurance is really to provide that sense of security, a sense of benefits, and a sense of teamwork to what can happen. And so I've got the easy part of the talk about why it's important to have health insurance, and whether or not you agree with the political persuasions of the country, having the ACA, having access to health care through health insurance and a mandated level of benefits is going to make a big difference in terms of helping to keep people healthy. Because the biggest problem or challenge for me is getting patients through the door. If they don't come in and see a provider, if they don't see a nurse practitioner, a physician assistant, a physician, and talk about their health issues, they fester, they get worse than they need to be, and sometimes simple things that could be taken care of then become a very expensive and very prolonged kind of a thing. And so I think having this is important for having access and having that sense of security and belief that we'll be able to tackle problems. And, and that's really the critical piece to having our insurance. So, everybody, I hopefully we don't have the question of, well, do I really need to have insurance? Because there's so many things that can happen if you have access. And insurance allows us to have that access, to have that opportunity to address the issues. not only are we taught, is this zipping through here?
You're good.
Okay, well, so you may have had experiences of using emergency room care. And that's an important aspect of an opportunity to be taken care of. But there's so much more that we can do. And having health insurance helps us, allows us to get that done. You can come into your office for preventive exams and wellness visits so that we can look at where your health status is right now and try and keep it where it needs to be. Preventive services are often covered at no additional cost to you as part of your health plan, as part of your health insurance. So this is a benefit that maybe, you haven't had a chance to really explore or look at. But, getting cancer screenings, colon cancer screening, breast cancer screening, prostate cancer screening, skin exams to make sure we're not coming down with, skin cancers and things like that are things that can only happen if you come in and we can get these things ordered for you. And the health insurance plans will cover a lot of that. Getting screenings for diabetes, high blood pressure, management for obesity and weight management, talking to somebody about stopping smoking and developing healthy lifestyles. All of things are important things that need to get paid for, and your health insurance plan will help make that happen. Access to the medications then that could be used to prevent or treat multiple conditions are also an important part of the benefits of having a health insurance plan and a prescription drug plan. But then the other piece also is immunizations. Has everybody gotten their flu shot yet this year? Okay, if you haven't, this is the flu season now. The season to start getting our flu shots. And my understanding, it's better than last year's. So if you are going to use the excuse of, well, last year's wasn't a very good year, I think they got it right this time. And having the flu shot is an important thing to keep people healthy. Pneumonia shots, tetanus shots. And if you have kids, to get them through school, you often have to have their immunizations up to date. Health insurance covers that. And just like it's helpful prevention for kids, it has the same kind of benefits for adults. And so, lots of different things are provided and included within a panel of services through your health insurance plan. And so finding the right plan that fits your needs, that's going to cover these basic services to allow you to come into the office and work as a team to develop a better health plan, plan of wellness for yourself, and kind of strategizing on the best way of taking care of yourself is important. And, is it going to keep you from being hospitalized and does it keep you from being in emergency rooms? It might. If we can take care of some of these things, get chronic illnesses identified and managed and keep you out in the community, then you don't have to go to the emergency room. And we can prevent the complications from uncontrolled diabetes, uncontrolled high blood pressure, decrease the risk for strokes, cancers, heart attacks. And all of these things it can happen if we have that dialogue and you working with your physician, nurse practitioner, physician assistant, or other healthcare worker to kind of address these issues. But again, we can't do any of that unless you come in and see us. And so having the health insurance kind of is that bridge to make it possible for you to come in, have these conversations, and develop a wellness plan. So, some of the other benefits of health insurance. Well, is this just going on behind me?
Yes.
Okay, so
The joke's on you, Dr.
I know, apparently. So you can listen to me all you want, or you could read the slides. I was kind of thinking I was going to go slide to slide, but it's the message is here. You've got most people have cars or understand car costs and the importance of prevention for that in terms of forestalling expensive repairs down the line. Well, unlike cars, we can't trade our bodies in. And so we need to try and take care of it as we can, and doing some of those preventive services can lead to cost savings over the course of our life and improve the quality of our life. So not getting hit with unexpected expenses. Hospitalizations can be expensive. Emergency visits are not cheap. And having health insurance provides at least that sense of safety and security that if I have to use those things, I've got something to help me get through that and help cover those costs. But again, the more important thing is that if we can then, use the office visits and use some of our preventive and wellness services, then hopefully we wouldn't get to those points. The cost of things, when we think about what insurance costs you on the short term versus the potential long-term benefits, I think, it's pretty well makes a difference. And I think it's an important kind of a thing. Anything else that we wanted to cover? Okay. Are there questions of what I was talking about? I think, we're kind of laying the groundwork. You all understand, how important it is to see your healthcare providers and have that access. And really, the rest of this talk is kind of looking at how do I decide which plan and what do I need to think about and all those different things. But just remember that, given the opportunity to get health insurance, this is a great time for us as a nation and as a people here in Montana, across the country. And if we don't take advantage of those things, we know that healthcare costs continue to rise, and a lot of the costs are for the treatment of things that could have been prevented. So if we can work on blood pressure, work on blood sugar control, work on weight management, get you on the right kind of treatment so that you don't have to necessarily, the first time that you're seen, go to surgery or something like that. It's those kinds of cost savings that helps maintain our quality of life and helps the rest, our communities as well. And so hopefully those opportunities of what health insurance can bring to you, and whether or not you need it, but for your family members, for the friends, the people that you're going to talk to after this talk, helping them understand the importance of having the security and having the health insurance coverage is important. So thank you for that aspect of it, and I'm going to hand it off to the rest of our team.
Can everyone hear me? Yes? Thank you, Dr. Temporal. That was a great start. So we're going to get into the technical parts of insurance now. So this part gets a little bit dry, but we're going to try to make a little fun with the cartoons here. So basically, insurance helps pay your medical costs. So as Dr. Temporal said, healthcare is very expensive, and insurance can help you pay for that, and it can help you really pay for preventive care and things up front so that it's not more expensive later. So under the Affordable Care Act, there are 10 essential health benefits, is what they're called, that must be covered by every insurance plan now. So they are listed here, and it's really all kinds of care that you would have in any healthcare organization. So there's the first 5, so emergency room, outpatient care, hospital care, I guess that's only 4, and maternity care, so that's for the baby and the mom. Mental health services, prescription drugs, physical therapy or other therapy services after you have a procedure, lab tests, preventive services, and pediatric services. So every plan has to cover these 10 services. How much they cover is really dependent on which plan you choose, but all of them have to cover these services. So the way insurance generally works is that you pay a monthly amount to have the insurance, and that's called a premium. So we're going to use these terms a lot through the rest of the presentation. And then insurance helps pay when you access care for part of that care. So in general, the higher the premium that you pay every month, the lower amount you're going to pay when you actually seek services. You're paying more for that insurance for better coverage, and the opposite is generally true. If you're paying a very low premium, a plan that costs less, you're likely going to pay more of the bill when you actually seek the service. So you need to really look at how you use care. If you're expecting a lot of care, expensive care, then you need to balance that out with how much it's going to cost every month to have it. So the portion that you pay is called your out-of-pocket cost. And out-of-pocket costs are generally capped at an annual amount by law that you don't have to pay any more than that amount. But there's always exceptions to that, so we'll talk a little bit about that. And these are the different kinds of out-of-pockets. So there's co-pays, so that's an amount you pay when you go and seek care. So it might be $30 to see your primary care physician. You would pay that at the time of service, and that would pay for your visit to that provider. So that's a fixed amount that you pay up front. A deductible is a dollar amount that you have to pay before your insurance will pay for anything. Sometimes you have to do the deductible first before you pay copays, and sometimes you can pay a copay. And the plans this year on the marketplace are very tricky about this. So you need to really understand, do I have to pay a $10,000 deductible before I get any help from the insurance company? That means I have to pay $10,000 before I get any help. Or am I going to have some copays where I can go to the doctor and I'll pay $30, and that's okay even if I haven't paid my $10,000. So you need to really look at that, and that's changed a lot this year, where you used to always be able to do your copays, and now sometimes they're making you pay a deductible first before copays would apply, especially on the prescription drug portion of plans. A coinsurance is normally a percentage of how much you are going to pay after the deductible. So let's say you had a $5,000 deductible and you have paid that much for the year, then coinsurance usually comes into play, and that might be 80%, 20%, so you would owe 20% of anything remaining. Sometimes that's 40%, 60%, and you would owe 40% of what that amount is. So you need to look at how much you would pay after the deductible. And then there is a maximum out of pocket. So that's the most you would pay during the coverage period, which is generally a year. And what is it, Jan, this year? Do you remember?
I want to say it's 13,275 or something like that.
13 for a family,
Yeah.
right? Yeah. So usually there's an amount, and that would be specified in the plan, that's the most you would have to pay. But I'll tell you an exception later. So hold on. Don't forget. And then we have the penalty. So this is the penalty for not having insurance. Most people are required to have health insurance. And in 2016, you need to have it for 9 months out of the year. That is considered having insurance for the year. It doesn't have to be April through December, but you need to have it for 9 months out of the year to qualify. And if you don't have it, the penalty is going up substantially in 2016. It is the greater of 2.5% of your income, or $695 per adult. There's a half that amount per child, and the maximum for a family would be $2,000. But it's the greater of 2.5%. That was $95 the first year of required to have health insurance. So it's getting to the point now where the penalty will be more than buying insurance. That will be assessed on taxes that are filed April of 2017 is where that will be reconciled. So you need to know this now because that will be very important when taxes are filed. There's always exceptions or exemptions from the penalty, and some people qualify for one. One of them was we didn't have Medicaid expansion, and so if you would have qualified for Medicaid, you were exempt from having health insurance. We have Medicaid expansion now, and so that exemption won't apply. But there's other exemptions. There are a few, and we could help you with those details. So there's many ways to get covered. Medicare is one way that qualifies as having insurance. That's for people 65 and older. There's Medicaid, which is for adults based on income or health status. That's regular Medicaid. Healthy Montana Kids is for children, and that's based on income. You might get it from your employer, and that would qualify. You can get it from your college if you're a student. If you have the VA, coverage for the VA or TRICARE coverage, that qualifies as having insurance. And if you don't get it any other way, then you can buy it individually off the marketplace. We'll talk a lot about that. Or now there is the Montana Help Plan, and that is new for 2016. And that's the Medicaid expansion plan, so that is going to help a lot more people qualify. That's also for adults based on income. So we're going to talk about the health insurance marketplace. You've probably heard a little bit about this. So it's really a website, healthcare.gov, and it is where you can go find out what you qualify for and shop for health insurance. So it's going to really take you through two doors. One door is state-run plans, so that's Medicaid, the Healthy Montana Kids programs, and the new health plan. So on healthcare.gov, you would put in your information, your expected income for 2016, and it might say, hey, you're going to qualify for one of these programs, or your kids might qualify for one of these programs. And that would be all you would have to do is fill out that application on healthcare.gov, and it would say you qualify. That information is going to be forwarded to the state, and they will contact you to get you all finalized for 2016. JJ is going to talk quite a bit about some details of the health plan in a minute. If you don't qualify for one of those programs, then you can shop for private health insurance plans on the marketplace. And that's private insurance through health insurance companies, and you can look at many different plans. There's dozens actually available at different levels of coverage and different prices. So JJ, I'm going to have you talk about the health plan.
Okay. Can you guys hear me? Oh, there we go. So how many of you out there followed the whole Medicaid expansion or HELP plan scenario as it played out in our state legislature last year? As many of you probably know, it was quite a contentious debate, but we did pass it, and so it's here. So regardless of your politics, this is a good thing to know. It may not apply to you, but it might apply to your friends, neighbors, whomever that is actually seeking additional care and coverage that they couldn't get before. So one of the strangest things about the health plan is, what do we call it? So its technical terminology or technical name is the health plan, but we also refer to it as Medicaid expansion. And it is our state's version of Medicaid expansion. It's a new low-cost health coverage option for you. So the qualifications, we have two scenarios up here, one being single and the other being family of four. So the income levels in order to qualify for Medicaid expansion or the health plan, $16,000 for a single person, $33,000 for a family of four. Also, this is for adults, non-Medicare age adults, so 19 to 64. We'll talk about the kiddos later. We're not leaving them out. But this Medicaid expansion really applied to healthy, working, or non-working adults that were over traditional Medicaid coverage. So anywhere between 19 and 64 that's a Montana resident may qualify for the health plan coverage. And that coverage includes those 10 essential benefits that Becky referred to earlier. And then the state decided to include a couple of extra things. So there is dental coverage and vision coverage available, as well as some transportation to and from appointments when necessary.
So there is a printout that you should all have that will give you information about the different income levels. These are just examples. So this is an example for a single person or a family of four, but it will take you all the way up to a family of 8, and it'll tell you the various income levels to qualify for the different programs. So it is all in one place so that you can refer to that.
Yes. Thanks, Becky. And the website actually, when you go on to healthcare.gov, it sort of walks you through that, so it will actually make the calculation for you,
right?
Which is kind of nice. So moving on, it is available to people qualifying for a low or no monthly premium depending on your income levels. So if you're traditional Medicaid and you qualified before under traditional Medicaid, there isn't any premium. There's no monthly cost to it. However, if you do qualify under the Medicaid expansion benefits and your income's over a certain level, then you might have a 2% premium. So it's 2% of your income. There is a monthly premium attached to that. That is different than Medicaid programs in other states and different than traditional Medicaid. So then we get to the out-of-pocket cost. And there again, if you're at a $0 premium, you're going to have very limited out-of-pocket costs. And we're literally talking single digits, $2 or $3 for a physician visit and maybe $100 for an inpatient hospital stay. So very low out-of-pocket costs. If you qualify for at a higher income level, you'll have a 2% monthly premium, and then your out-of-pocket costs aren't going to be any greater than 5% of your income. So that's sort of that out-of-pocket maximum. So you're going to have both cost sharing and a premium under Medicaid expansion.
And remember that 2% is less than the 2.5% that the penalty is.
Yes. So that is a good comparison. So
So
you're
you
either going to pay 2.5% of your income
For
as a
health insurance.
penalty, or you're going to pay 2% of your income towards having health insurance. If you pay the penalty, you're out that money and you have no health insurance. So that was structured very purposefully by our state legislature and the people who crafted the bill, so that you're going to pay less to get the coverage than you would have if you didn't get the coverage. So there is a special caveat even under expansion. Medicaid was very limited before, and so it wasn't just about not having any money. You actually had to be very poor and also be disabled in order to qualify for coverage. So now the disability requirement is gone. So there might be some of those people that have very, very low incomes that don't have a disability. Those people will now qualify at a $0 premium. And there again, these are just examples of the single person or the family of four and what your out-of-pocket maxims might be in those cases. So back to Becky. Are any questions on that right now? We'll get to the kiddos part later. Sorry.
On the new health coverage, with Medicaid, if you had assets at all, you didn't qualify?
There is no asset test whatsoever, so that is a really good question.
So to this new
Yeah.
expanded Medicaid, there's no asset?
Yes.
It's annual
Yeah.
income.
It's annual income.
It's just strictly annual? Okay.
Correct.
Yes.
Thank
So-
you.
So now I'm going to talk about the other door. So we had the one door about Medicaid expansion, the health plan, Healthy Montana Kids. I'm going to talk about the private side. And you'll see on that chart again, that's the parts in purple. So there's different plans to choose from. So the health plan, it's one plan. If you qualify for it, that's the plan, and it's structured in a certain way. On if it's through the other door, then you have a choice, and the choices are pretty, there's a breadth of them. This all happens again on healthcare.gov, and so these are the private plans. So there are different types of plans. They're called metal level plans because we have the metals here. So there's bronze, silver, and gold, and there used to be platinum plans in our market, but they're going away for 2016. So we will only have 3 levels of plans in Montana. I'm talking in just Montana right now. Anyone from Wyoming? Or want to know about Wyoming? Okay, Montana, these are the 3 types of plans. So we talked about, remember, that we have premium and we have out-of-pocket cost. So in general, the premium is the lowest for the bronze and the highest for the gold. So you're going to pay less for a bronze plan than you are for a gold plan. However, if you buy a bronze plan, you're going to have a lot of out-of-pocket, maybe a $10,000 deductible before you get any help with your coverage. So you really have to think about, again, which one is best for you based on your circumstances, what you can afford a monthly premium, and what kind of services you may need, healthcare services you may need. Now, the out-of-pocket that we've talked about, so that's the deductible pieces, the co-pays, the co-insurance, right? All of those pieces when you access care. You may qualify for a reduction in those only if you buy a silver plan and if you're at the income levels that are on that chart that are 250% or below. So if you are at that level of income and you want to get additional help with your out-of-pocket cost, you have to buy a silver plan. So there's a lot of reason to think about a silver plan if you're in that situation. Because you could get a reduction in your out-of-pocket by 94%. So you would only pay 6% of what you otherwise would have paid, potentially, depending on income. Yes?
Just, your annual income, is that before or after taxes?
So the annual income is your modified adjusted gross income. So before. So again, the balance. Low premium, high out-of-pocket cost, or high premium, low out-of-pocket cost. And then don't forget the silver plan. So you need to think about how you use healthcare. There is on healthcare.gov a shopping experience where you can go in and you can put in you have low healthcare needs or high healthcare needs, and it'll kind of give you some sense of what plan might be best for you. But you really need to think about, it's a very individual decision for each person, depending on how you use healthcare. So the question, will I save money? Can I get a discount? So again, we're talking about the private side, remember, the private health insurance side. So if you buy a private insurance plan through healthcare.gov, it has to be through healthcare.gov to get these savings. You can't go and buy a plan from your insurance agent not through healthcare.gov and get these savings. So it has to be through healthcare.gov. And you can get a discount on your monthly premium and the reduction in your out-of-pocket cost at different levels of income. So that's again on the chart, but here's examples. So you can qualify for a lower monthly premium at the range of $16,000 to $47,000 for an individual, or up to $97,000 for a family of four. That's where you would get a tax credit to help you pay your monthly premiums. And then you can qualify for lower monthly premiums and lower out-of-pocket costs. That's what I talked about with the silver plan. If you are up to $29,000 as an individual or $60,000 family of four, and then the different numbers are there for other. But again, silver plan only if you want to get those out-of-pocket reductions.
So, one note of interest, I think last year was about 84% of Montanans qualified
That's
for
right.
some sort of subsidy on the marketplace. To
Yeah.
put that into perspective, it's worth a shot. A lot of people do qualify.
Is your microphone?
Oh,
Oh, sorry. You wanna
right,
repeat that?
right. So what JJ's point was is that 84% of Montanans last year that signed up for a private plan through healthcare.gov qualified for savings, either in their premium or in their out-of-pocket cost, 84%. Now, the Medicaid help is already set at a reduced premium of 2%. So that's already set up for you to get those savings on both the premium and the out-of-pocket. It's inherent in the plan design. So here's the kiddo part, and I'm going to have JJ talk about that.
Okay. I think this is on. A lot of this isn't new, but we wanted to repeat it. So Healthy Montana Kids has been around for a long time. It's been under several different names. A lot of you might know it as the CHIP program. It's called the CHIP program in a lot of other states. But we wanted to just reiterate, because a lot of people would come and they talk about Medicaid expansion, and they're like, why is it only for 19 to 64? What about the kids? Why is it only adults? And the reason it's only adults is because we've taken steps as a state to cover kids at an expanded income level, parental income level, to make sure those kids are covered. So if you go to healthcare.gov, you might find inadvertently that your kids have been eligible for this all along. And the beauty of healthcare.gov is that it does walk you through this, and it tries to find you the coverage that's best for you, that's least expensive, and point you in the right direction. Oh, hey, your kids qualify for Healthy Montana Kids Plus or Healthy Montana Kids. So the Healthy Montana Kids Plus is more the traditional Medicaid type coverage. Healthy Montana Kids is what we would refer to as CHIP coverage, or might be referred to as CHIP coverage in other states. And so the income levels, as you can see, they're probably on your chart, I'm guessing. The income levels are higher for these kids, and so it's more of an expanded income that qualifies you than for the adults and the Montana Expanded Medicaid. So you can qualify anywhere from $16,000 to $30,000 for an individual. You can get your kids qualified under Healthy Montana Kids or Healthy Montana Kids Plus. And then for a family of 4, it goes up to $63,000. So most people can and should be taking advantage of this already, and this isn't related to Medicaid expansion, but it is when you start to think about your kids might be under a slightly different coverage than you are if you are on Medicaid expansion or something else, that your kids might be under this coverage. So.
Here's the Medicare question. Medicare and the health insurance marketplace are not the same thing. If you have Medicare, you don't go to healthcare.gov, you go to medicare.gov. So there was a lot of confusion when the marketplace first opened, and Medicare people with Medicare thought, I have to go buy a plan on the marketplace. You don't have to. So the answer is no, you don't have to do anything with the health insurance marketplace if you have Medicare. We have a department, Senior Life. Bob Kelly is here, and he has some cards to hand out. It is open enrollment for Medicare right now. Medicare Part D, Medicare Advantage, supplement plans. And so we have a department, Senior Life, and they do consultations all throughout to help you pick a different plan if you need to. But it's not the health insurance marketplace. So I just wanted to make that distinction.
And one of the other distinctions I'd like to make with Medicaid expansion is that we have a lot of people who are crossover, who are dual eligibles, and so they have Medicare as primary and Medicaid secondary. Medicaid expansion did not change any of that relationship, how any of it worked, or what qualifies.
So I get to help you with some of the other nuances about selecting a plan. One of the things that was really promoted when healthcare, the Affordable Care Act came out was, can I still see my doctor? Well, probably, but you have to know, is your doctor in the network of the plan that you're proposing to select? That's very important. A provider network is a group of doctors, hospitals, and pharmacies and other providers who your health insurance plan has contracted with. That means they're in network, but not all providers, hospitals, pharmacies are in network. They could be out of network with your plan. And when your provider or your pharmacy is in network, you're going to pay less out of pocket. And in fact, those free preventive services that your health plan is providing you, they're only free if you go in network. You could pay up to full billed charges if you had those free preventive services out of network. So it's very important to know, is my provider in network with that plan? Okay. So Billings Clinic is in network with all the Blue Cross Blue Shield plans, the Pacific Source plans, with Access Care that's provided by the Montana Health Co-op, the Montana Help Plan, the Medicaid expansion plan we talked about, Medicaid, Healthy Montana Kids, and Healthy Montana Kids Plus. But we are out of network with the Montana Health Co-op Connected Care Plan. So it's very important that if you choose a provider at Billings Clinic, that you be aware that if you have the Connected Care Plan, you could have much higher out-of-pocket costs. So before you enroll, our recommendation, honestly, is to call that health plan and find out, is this provider, is this hospital, is this pharmacy, whatever is critical to you in network. Because there has been some challenges with the provider lists that are available on healthcare.gov being up to date and current. So just to be sure, make yourself feel comfortable before you enroll, call that health plan and say, is my doctor, if you have one of choice, in your network with this plan I'm considering. And for Billings Clinic, you can see we have billingsclinic.com insurance finder link there. We keep this up to date with all of the health plans that we are currently in network or out of network with. So you can always use that as a resource. Are my medications covered? Very, very similar investigation that you need to do. Insurance companies have what's called a formulary. A formulary is a list of all the prescribed medications that are available under the health plan. You probably have heard terms like, that's a generic. Well, generics will be split out with some of the more name brand pharmaceuticals that you may need. And you need to be aware, is the drug that I need, is it generic? Is it in tier 1, tier 2, tier 3, tier 4? Obviously, the tier 1 is probably the generic, has a very low out-of-pocket cost for you. But if you have an expensive name brand that you have, it could be a much higher out-of-pocket. But it's different with every health plan. So you need to be conscious of what medication am I taking and do an evaluation of that health plan and where does it fall in that health plan's tiers to, if that is something that you know is a major expense for you, that you have a monthly prescription cost of $200 and that's really what you spend every year, then knowing what your health plan covers for that medication is very important. And on healthcare.gov, there are tools to help you make some of those choices. But we also recommend that you talk to that health plan before you enroll again to make sure you understand how their formulary works. So, can I just wait to sign up if I get sick or injured? This is one of the things that people talked about a lot when the Affordable Care Act first started. Fortunately, no. It's just like you can't buy car insurance after you have a car accident. It just doesn't work that way. Most insurance is not retroactive, rarely. And so you need to be aware that there's only certain times a year that you can enroll. And generally it is open enrollment, which is the season we're currently in, for healthcare.gov. There are some exceptions, however. Some people may qualify for Medicare in their birth month, so that's an exception when you turn 65. You can qualify anytime for Medicaid or the new health plan, or if your income changes, your children now may become eligible for Healthy Montana Kids or Healthy Montana Kids Plus. And there's also some special enrollment periods for the health insurance marketplace. Things like if you get married, if you have a baby, if you move out of state, those are some of the, in losing a job, those are some of the special enrollment periods that you may take advantage of that allow you to enroll or make a change outside of the open enrollment. So can I change the insurance plan I already picked? Well, that kind of depends on where you are in the year and some of those circumstances, but during the open enrollment season, which started November 1st and now goes through 31st of January, the only time you can make those changes for insurance to start on January 1st is before December 15th. So that's a very critical time, is to get everything squared away before December 15th so that your insurance is in effect by the 1st of January. Okay. Sorry, I wasn't paying attention to your slides, Becky. The Montana Health Plan has a little nuance, though. The first day of available coverage is the 1st of January, same situation. But enrollment will be year-round, just like Medicaid is today, and as I said, for Healthy Montana Kids for children, too. Okay?
There's that December 15th date.
Yep, there's that.